Hello everyone, my name is Amanda and I am an occupational therapy student at the American Stroke Foundation. In this video, we're going to talk about sleep apnea and why it is especially important for survivors of stroke to address any concerns with their doctor and commit to taking their sleep apnea treatment seriously. Before we get started, it is important to note that I am not a doctor and this is not specific medical advice. This video will cover some general information about sleep apnea, including risk factors, symptoms, and common treatments. If you have any concerns after watching this video, please reach out to your doctor. First, let's start by defining sleep apnea. It is a condition that results in abnormal breathing because of changes in a person's airflow that occurs while they are asleep. People with sleep apnea have multiple extended pauses in breath when they sleep. These temporary breathing lapses cause lower quality sleep and affect the body's supply of oxygen, leading to potentially serious health consequences. There are a few different types of sleep apnea, but by far, the most common type in both the general population and in survivors of stroke is called obstructive sleep apnea, or OSA. This is the type of sleep apnea we will be discussing in this video. OSA occurs when the muscles in the back of your throat relax too much to allow normal breathing. These muscles support many important structures, including your soft palate, which is the back of the roof of your mouth, your uvula, which is the triangular piece of tissue hanging from the soft palate, your tonsils, and your tongue. When the muscles relax, those important structures are no longer supported and cause your airway to narrow or even close as you inhale, impairing your breathing. Looking at the picture on the left, by following the path of the arrow, you can see how the air you breathe gets to your lungs. Compare that with the picture on the right, which shows how, with OSA, the airway gets blocked, causing the person to stop breathing. When this happens, your brain can tell something is wrong and will momentarily wake you up enough so that you can reopen your airway and resume breathing. Most of the time, these interruptions to your sleep are so brief that you don't remember them happening. This sequence of events can happen many times each hour, all night long, preventing you from achieving the restorative sleep that your body needs to function properly. So what does this have to do with stroke? Why is this important? Well, research has shown a significant connection between sleep apnea and an increased risk of stroke. In fact, the American Stroke Association notes that, quote, sleep apnea can be an after effect of stroke, but can also be the cause of a first-time or recurrent stroke. The condition causes low oxygen levels and high blood pressure, both of which can increase the risk of a future stroke, unquote. Anyone can develop obstructive sleep apnea. However, certain factors can put an individual at increased risk of developing it, including excess weight, high blood pressure, chronic nasal congestion, smoking, diabetes, and being male. Research has shown that, generally speaking, men are 2 times more likely than premenopausal women to have OSA. It should be noted, however, that the likelihood of having OSA increases for women after menopause. Other risk factors that are important to consider are as follows: having a narrowed airway, having a family history of sleep apnea, and having asthma. Getting good sleep is extremely important for maintaining brain health. So, it is especially important for survivors of stroke to address any sleep problems with their doctor. If you suspect you have sleep apnea or have previously been diagnosed with it, it is especially important to work with your doctor in order to help prevent future strokes from occurring. In this next part, we will be talking about specific symptoms of sleep apnea and the importance of sticking with your prescribed treatment. This graphic represents a questionnaire that is a common tool used to determine if sleep apnea may be a concern. Each word or phrase you see on the screen has a question associated with it. Before I start asking the questions, please keep in mind that this is simply a screening tool and cannot be used to diagnose anyone with sleep apnea. The purpose of going through this questionnaire is to help you determine if this is something you need to discuss with your doctor. This questionnaire consists of 8 yes or no questions. As I ask each question, keep track of the number of questions for which your answer is yes. You may have to ask others in your household about their observations. We will start with the top left box and work our way down that left column before moving on to the column on the right. Starting at the top left box, S is for snoring. The question is, do you snore loudly? Or more specifically, do you snore louder than talking or loud enough to be heard through closed doors? Moving down, the T is for tired. The question is, do you often feel tired, fatigued, or sleepy during daytime? O is for observed. The question is, has anyone observed you stop breathing during your sleep? P is for blood pressure. The question is, do you have or are you being treated for high blood pressure? Now, starting at the top right, B is for BMI or body mass index. The question is your BMI higher than 35? If you do not know, you can either ask your doctor or calculate it yourself if you know both your height and weight. There are online BMI calculators that you can search for to help with the calculation if needed. Moving down, A is for age. The question is, are you more than 50 years old? N is for neck circumference. The question is your neck circumference greater than 40 centimeters? You will likely need some help measuring around your neck. This is also something that can be measured at your doctor's office. Finally, G is for gender. The question is, are you a male? If you answered yes to 3 or more questions, then this is likely something you should bring up with your doctor so they can decide the best course of action to take. If you suspect that sleep apnea might be an issue for you, and you do not already have a sleep specialist, make an appointment with your primary care physician to discuss your concerns. If your doctor also has concerns, they will typically make a referral for you to see a sleep specialist who will direct any further courses of action. If the sleep specialist also suspects that sleep apnea is a concern, you will be referred to have a sleep study conducted. Sleep studies can be conducted in a clinic or at your home. This can depend on several different factors, including your needs as a patient and what your insurance company will pay for. After your sleep study, you will likely see your doctor again to review the results and, if needed, discuss treatment options. The most common and most effective treatment is the use of a continuous positive airway pressure or CPAP machine. A CPAP machine works by delivering air through a mask that fits onto your face. The pressure of the air delivered through the mask is slightly higher than the pressure of the surrounding air. This higher pressure is what helps keep your upper airway passages open. This reduces the number of times you stop breathing when you sleep, allowing you to get higher quality sleep. This helps ensure your brain receives enough oxygen throughout the night and helps prevent another stroke from occurring. CPAP machines used to be large, bulky, and loud. Luckily, CPAP technology has continued to advance with the times. Newer machines are often much quieter, as well as smaller and easier to transport. If at first you don't succeed, try again. There are many different types of masks, each designed for different needs. If the mask you have isn't working for you, contact your doctor to discuss other options. As I mentioned previously, the C in CPAP stands for continuous. This means the air pressure stays constant while the machine is in use. This is not the only type of machine used to treat sleep apnea, however. Other positive airway pressure machines also exist that can vary the amount of air pressure delivered. This means there may be other options for the type of machine you are prescribed. The bottom line is that it is very important for individuals with sleep apnea to be consistent by using their CPAP machine every night. This is especially important for individuals who are also survivors of stroke, as untreated sleep apnea can dramatically increase the chances of having another stroke. If you're having trouble using your CPAP machine every night, you should consider contacting your doctor to find a solution that works. Obstructive sleep apnea is considered a serious medical condition. This is especially true for survivors of stroke. Therefore, if you think you may have OSA, contact your doctor. If you have already been diagnosed with OSA and have a CPAP machine, make sure you are using it consistently. If it has been a while since you have been to your doctor regarding sleep apnea, schedule an appointment to discuss if any changes need to be made to the settings on your machine, especially if your weight has changed since last seeing your doctor. If you have any issues with your mask or the machine, make sure you contact your doctor so that you can work together to find a solution that will allow you to continue treating your sleep apnea. Thank you for watching this video about stroke and sleep apnea. Here are my references in case you would like to learn more.